issue in my good old doc. Trust issue where my friends all talk.
Okay, next up is Dr. Tony Hampton, a family and obesity specialist with a master's in nutrition. He works in Chicago, including in its poorest neighborhoods, and he's also involved in programs to get fresh foods to those areas. He's written a book, and he hosts the popular Protecting Your Nest podcast. Please welcome Dr. Tony Hampton.
I am more than excited to be here today, so thank you, Nina, for the opportunity. And my good friend, Denitra, as she's taking images, I appreciate you as well. I started my medical career like many physicians. I remember hearing that famous quote, "Let food be thy medicine." At the time, I didn't fully grasp how deeply that idea would shape my medical journey. It wasn't until about 12 years ago when I was desperately seeking ways to help my wife, who has type 1 diabetes, that I truly understood what it meant. Did you know that the average person with type 1 diabetes has an A1C of 8.6, which reduces their life expectancy by 12 years? I believe that's partly due to following dietary guidelines that do not serve them. I don't want anyone with type 1 diabetes to lose 12 years of life, and certainly not my wife. What's more, most people with diabetes experience something called diabetes distress. This is the emotional burden of constantly managing blood sugars, taking medicines, and worrying about those many complications we all hear about. It leads to burnout, frustration, and feelings of failure. The dietary guidelines, which promote carbohydrate-heavy meals and frequent eating, only makes this worse. They put people on a blood sugar roller coaster, forcing them to constantly chase high and low blood sugars. This doesn't just add stress, it makes effective management nearly impossible. But despite the good intentions of her doctors, whether they were her primary care doctor or her endocrinologist, none of them seemed to realize that one of the best ways to manage type 1 diabetes was not by insulin, but by reducing carbohydrate intake. How simple of an idea. We followed their advice, monitored her sugars, but it wasn't enough. It wasn't until we took control of her diet that things began to improve, and that's a low-carb diet. And this isn't just about my wife. Metabolic health is an issue for all of us. All of us know someone who's not metabolically healthy. 93% of Americans are not metabolically healthy. This means that the majority of the population are at risk for diabetes, heart disease, polycystic ovarian disease, stroke, etc. And for those who live in fear because your family history includes things like dementia, cancer, and chronic diseases, I'm here to tell you that your family's history is not your destiny. So, if we truly believe that food can be our medicine, if we recognize that medication, surgeries, and procedures aren't always the answer, then we have a responsibility to move forward in a different way. So you can help me by saying we are moving forward. So we are moving forward from a world where poor metabolic health is not the norm. We are moving forward from the belief that type 2 diabetes is irreversible, or that people with type 1 diabetes can't achieve normal A1C levels. We are moving forward from the outdated fear that saturated fat is bad for us and that we have to graze like a cow every single day to be healthy, eating fiber. We are moving forward from relying on a total cholesterol and an LDL cholesterol as a predictor of heart disease. We are moving forward from health systems and doctors like myself who aren't dealing with the root cause of disease. We are moving forward from organizations that prioritize their sponsors over the health of the people they claim to serve. So let's think about the future. We're moving towards a future where doctors, like myself, are trained to use food as their primary tool for healing, where dietary advice is grounded in sound evidence, not outdated guidelines that are not serving us. A future where healthcare systems work side by side with patients, helping them overcome the barriers that have kept them from achieving their true health. A future where access to healthcare isn't just about seeing a doctor, but also having the support and coaching necessary to succeed. A future where organizations like the new American Diabetes Society will lead us to better outcomes and more and less confusion. And just as importantly, a future where nobody has to worry about diabetes distress, like my wife, and where my wife will never have to worry about losing 12 years of life because she's following the dietary guidelines. So I ask you guys to join all of us so that we can help our families, our friends, and the community achieve metabolic health. Let food be thy medicine, because we are moving forward and we're not turning back. Thank you for your time, guys.